Hey Stubby Nails Club! Today we're going to be talking about 6 things you may be forgetting in your explanation when your clients come in for that perineal massage education session. Number 1, you guys may be forgetting to mention that they should absolutely bring their partners in for this session, especially if they expect their partners to be helping them with the perineal massage twice a week. So this can be done in a few different ways. Sometimes the client's not necessarily comfortable with all 3 of you working internal vaginally, and sometimes they are. So always make sure to gather consent a session before so it doesn't leave room for any awkward conversations for your perineal massage session. You can always demonstrate the amount of pressure that you would apply to the introitus by the partner's hand. And so this is what I'll typically do. I'll show how much substantial pressure is pressed and whereabouts, how to perform the techniques on the introitus. Number 2, you may not be educating your clients or their partners enough on how substantial the pressure is that is applied to the entryway. Oftentimes, I think the biggest, most common mistake I see is that clients are really pressing very gingerly, and this is not really helpful when it comes to perineal massage education or perineal massage doing, because we want to apply an amount of pressure that could mimic baby passing through the canal. And so you want to set up a scenario where there's an immense amount of pressure at the entryway and see how the client responds to that pressure. You may notice that sometimes the response is a gripping and protecting, and so we want to downtrain the nervous system. So that leads me to number 3. You may not be explaining the true reason of why we're doing the perineal massage. I think the biggest misconception here is that, hey, we're just going to stretch the soft tissue, the connective tissues, and get them nice and pliable. However, when we think about how the cervix needs to dilate to 10 centimeters, are we performing a perineal massage to get their vulva entryway to dilate to 10 centimeters? I'd hope not. So really that leaves the why for the perineal massage, as we want to learn a way to down-regulate, down-train the nervous system as we're applying an uncomfortable amount of pressure to the entryway. That's the real key here to a perineal massage. Number 4. You may not be explaining the 7 benefits that they found in the meta-analysis study on how important antenatal perineal massage really is. Just to recap, some of those points were reducing the risk of 3rd and 4th degree tears, reducing the risk of having increased amount of perineal pain, that space between the vulva and anus, reducing the risk of episiotomies as well, reducing the risk of fecal incontinence. To get the full list and to get the study that we're talking about, please look at the link below and we will share that meta-analysis with you there. Number 5. You guys may be forgetting to mention that the perineal massage can be initially done in the most comfortable position for the client, but once they get used to this, they can absolutely try the perineal massage in any birth position as well. What a great way to practice ahead of time. See if the pelvic floor can really be in a very relaxed, calm state as you're, for example, on all fours or maybe in side lying. See if it's even possible to have a really nice reverse Kegel or relaxation happen at the pelvic floor with the pressure applied as well. So don't forget to mention that it's always an option to try the perineal massage in a different position as well. Maybe even the position that you ideally would like to deliver the baby in. Number 6. You guys may be forgetting to mention that the perineal massage is expected to be a little bit uncomfortable. Now, why this is important to mention this expectation is I can tell you a little anecdote about when I first received my perineal massage from my pelvic health physio. I had no idea it was going to be as uncomfortable as it was going to be. Those first initial presses were quite tender, and I had this internal thought thinking to myself, am I really going to be able to do this to myself for twice a week for the rest of my pregnancy? Am I really going to be able to withstand this within this session, this pelvic health session that I'm at right now? This is really quite uncomfortable. And so I think communicating that, hey, it's okay that we begin out a little bit uncomfortable, but by the end of the perineal massage, there should be more and more feelings of relaxation as long as we're practicing cues on how to downregulate your nervous system. You might be shocked by the end of those 10 minutes of perineal massage or 15 minutes. This pressure might feel like next to nothing or very, very little discomfort. And that's exactly what happened in my session. I focused on my breathing. I focused on visual cueing of my pelvic floor. And before I knew it, I had to ask my pelvic floor physio, hey, are you still applying the same pressure? Because this feels totally fine. Hey, are you still at my 6 o'clock, 7 o'clock? Because that didn't feel good at the beginning, but now it's feeling fine again. So making that expectation clear is really important to reduce drop-off or compliance of performing the perineal massage. So make sure you mention that, hey, you know what, initially it might be a little uncomfortable. Keep at it, keep going, keep focusing on your breath, focus on down training the nervous system, and let's see how it goes. So there are far too many benefits that outweigh that initial discomfort, and communicating, again, those benefits can be really helpful for compliance again. We hope you found these tips and tricks helpful. Please subscribe to our channel, the Stubby Nails Club on YouTube. And don't forget, we also have a Patreon group, which is also called the Stubby Nails Club. On there this month, you're gonna find a 10-minute video that shows you how we'd explain perineal massage to a client that's coming in to see us. So we're gonna use the exact same language that we would use and our what, why, how, where, when speech. That's one not to miss. We hope you guys enjoyed the video. Have a great day. Bye.